Welcome back to the Genetics Lecture Series. Today we're going to be talking about newborn screening for rare but treatable conditions. The purpose of newborn screening is to identify conditions that are treatable but may not be immediately apparent when the child is born, and that if left untreated are associated with either morbidity or mortality. The objectives for today's podcast are to review general criteria for an effective newborn screening program, to review newborn screening across Canada, and to review the process of newborn screening in Alberta. Newborn screening is offered to every child born in Canada to look for rare but treatable conditions. You've already learned about what makes a good screening test, so we will briefly review the general criteria for an effective newborn screening program. In order for a condition to be appropriate for newborn screening, it must have both clinical validity and utility. For a condition that cannot be identified with routine observation and physical exam, there needs to be a test that is rapid and cost-effective, and the test needs to be highly sensitive with ideally no false negatives, and reasonably specific, with as few false positives as possible. Diagnostic testing needs to be available to confirm the diagnosis in those who screen positive. Treatment needs to be available too, and there needs to be some benefit to starting the available treatment early, usually prior to symptom onset, as opposed to when the symptoms present themselves. Newborn screening is mostly comprised of testing the blood of newborns for abnormal levels of various substances that are associated with specific conditions or diseases. A more broad definition of this program, though, includes bedside screening for congenital hearing loss and cardiac disease. You will be learning about these bedside screening programs elsewhere, so we'll be focusing on the blood tests in this podcast. In Canada, there is no national consensus as to which conditions should be screened for, so newborn screening programs vary from province to province. In Quebec, they screen for 14 conditions using blood and urine samples, while the remaining provinces use only blood samples. Ontario currently screens for the most number of conditions. It can actually be a bit difficult to compare the numbers from province to province, because provinces count the conditions in different ways. On the Alberta Health website, for example, they list 22 conditions that they screen for, but you will note that I list 25. The reason for the discrepancy is that they are combining some conditions and tests together, which accounts for their number being lower than what I'm presenting. For example, there are 3 sickle cell genotypes that they test for, but they only list sickle cell disease once. While Alberta does it this way, another province will separate out the genotypes as different conditions. In order to remain consistent, I have listed the number of conditions per province as the number of distinct conditions that they ultimately test for. This is not something for you to get hung up on, and you will not be tested on these numbers. What is important for you to recognize, though, is that where a newborn is located in Canada determines which conditions they're screened for. The territories send their samples to the provinces for analysis, and note that if you live in Nunavut, a newborn sample is sent to either British Columbia, Manitoba, or Ontario, so there's even some discrepancy within that territory regarding access to screening. Newborn screening can be grouped into 4 categories. Metabolic disorders, where the individual is unable to break down certain nucleic acids, fatty acids, or sugars. Endocrine disorders, hemoglobin disorders, and other conditions like cystic fibrosis, severe combined immunodeficiency, and spinal muscular atrophy. There are 9 conditions that are screened for in all provinces. All of these conditions, with the exception of congenital hypothyroidism, are considered genetic disorders, and they all display autosomal recessive inheritance. Congenital hypothyroidism, on the other hand, is most commonly caused by a spontaneous defect in embryonic thyroid gland development or thyroid hormone synthesis, which for the most part is not inherited. However, the literature does describe between 5 and 15% of congenital hypothyroid cases as having a genetic etiology. Newborn screening in Alberta started in 1967 with the introduction of screening for PKU. PKU is a metabolic condition where the individual is unable to break down phenylalanine, so it accumulates in the blood. Untreated, the individual is at increased risk for seizures, intellectual disability, and delayed development, as well as psychiatric diagnoses. The treatment is a restrictive diet low in phenylalanine. Since the discovery that abnormal metabolite levels could be detected in the blood, many conditions have been added to the newborn screening programs over time. Newborn screening is the standard of care in Alberta, but it is not mandatory. Blood is collected using filter paper from the medial or lateral portion of the plantar surface of a newborn's heel between the ages of 24 to 72 hours after birth. This is usually done while the newborn is in the hospital, but if the baby has been discharged prior to 24 hours, they get the screening through public health. Within 72 hours of collection, it is sent to Edmonton for analysis. Within 48 hours of arriving in Edmonton, the sample is analyzed and results are reported within 96 hours after analysis begins. Negative screens are updated electronically, but positive screens are reported by telephone to the newborn's most responsible provider and the relevant specialist clinic. The caregivers of the newborn are then called and the positive result is explained, along with an explanation of what is recommended for definitive diagnostic testing. Between 2020 and 2021, more than 48,000 newborns were screened in Alberta. At the time, Alberta tested for 24 conditions. Of the 48,000 newborns screened, 214 newborns had an abnormal screen result and went on for diagnostic testing. Ultimately, 57 were diagnosed with one of the 24 screened conditions. Newborn screening is dynamic, with the most recent condition, spinal muscular atrophy, being added to the newborn screening panel in 2022. We're going to be learning a bit more about this condition in the next podcast, as it helps to illustrate why a condition might be included on a newborn screening panel and how our understanding of genetics can be harvested for therapeutic strategies.